Hello, and welcome back to BioNexus Health Podcast, Autism Uprooted. Actually, it's not about just autism today, but many of you have written me to speak a little bit about PANS, which is Pediatric Autoimmune Neurological Syndrome. It used to be called PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. Later on, ongoing research showed us that it wasn't just streptococcus that was causing the symptoms, but it could be a variety of triggers that could initiate the same autoimmune response. So I'm going to illustrate a little bit as well. So let's go ahead and take a look at what is PANS.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
All right. I will be sharing my screen with you. So let me go ahead and do that. And this way, there's going to be slides and diagrams. Additionally, I'll be sharing some labs with you as well. So we'll have a good discussion. We'll go back and forth, and feel free once again to send me any additional questions you would like me to cover. All right, let's go. Let me start with sharing the screen. Give me one moment, please. Now, let me just follow the graphic for you. So understanding PANS and autism connection. Now, the human brain has a very important part called as the basal ganglia. And healthy basal ganglia are responsible for motor control and other important functions as motor learning, executive functions, behaviors, and emotions. The basal ganglia has many different nuclei in that region, and with vast and deep connections to many areas in the brain. So it's a very important part of the human brain. What happens is pathogens that can be bacteria, viruses, fungi, mycotoxins, etc. They invade and infect the person. It's not just the child, but since we are speaking pediatric, let's go with child. They invade and infect the child, right? Meaning you get an infection. Now, some molecules on the pathogens, on these invaders, they are similar, almost identical to the molecules found in the child's brain, like in the basal ganglia in the brain. That would be one example. We know that strep can affect the heart as well. That is another autoimmune issue. We know that arthritis can be autoimmune as well, osteoarthritis, rheumatoid arthritis. This is called as friendly fire. The body's own immune system attacking cells in the same body, so attacking self. Now, why does this happen? There can be numerous reasons. There could be immune suppression, immune compromise, or there could be an unknown reason why the antibodies get confused. Now, we know that children with autism, research has shown us that immunity is compromised. And we also know that when there are underlying bacteria and viruses, for example, Lyme disease and co-infection bacteria, they are capable of suppressing the adaptive immune system, right? It is your adaptive immune system that produces the antibodies. And when the adaptive immune system is compromised, then you can be at a high risk for immune dysfunction. And autoimmunity is one such immune dysfunction. So what happens is, as you can see here, the big red dots that you see on the pathogens, the bacteria, or the viruses. I mean, I'd rather say pathogens or invaders or the bad guys, because there can be various types, right? So the bad guys have these big red molecules. Now, these big red molecules appear similar or even same to the molecules in the basal ganglia. So what happens? The host, meaning the person, the child, produces antibodies. Now, these antibodies that recognize the invading pathogen, all right? So understand this, that the antibodies recognize the invading pathogen. However, some of them get confused. So while the antibodies generated by the child's immune system attack and kill the bad guys, but many get confused. Now, when they get confused, what happens? Where do they go? What do they do? What can they do now? Antibodies, human antibodies are very powerful. Okay, sorry, let's go to the next slide. Sometimes it goes too fast. All right, so this is the next slide, right? So the confused antibodies, unable to correctly distinguish the basal ganglia from the pathogen, from the bad guys, they end up attacking the basal ganglia cells instead. This is friendly fire autoimmunity, where because it is the child's own antibodies attacking the child's own brain, they are now termed as auto antibodies, attacking self. They attack the structures in the basal ganglia. Now, what happens? And you can see here the antibodies, some of them killing off the bacteria. I mean, again, bacteria, I just go, sorry, the pathogens or the bad guys. And there are some that go to the basal ganglia. And when I say some, it's in the thousands. The basal ganglia are obviously compromised, inflamed, damaged, and causes neuropsychiatric and other symptoms involving fine motor, gross motor, emotional control, behavioral control, obsessive compulsive disorders, sensory issues, oppositional defiance, aggression, irritability, eating disorders, motor tics, vocal tics, motor and vocal tics, like eye blinking, vocal tics, making vocal sounds continuously. Now, these can often erroneously be termed as stims, that, this child is autistic, and stimming is one of the common symptoms of autism. So it can be kind of swept under that autism rug if the clinician evaluating is not familiar with PANS. Now, many symptoms mimic symptoms of autism spectrum disorders and can be misdiagnosed as such. And when I say misdiagnosed, I don't mean the entire autism is misdiagnosed. I'm saying that the symptoms that are associated with PANS can be misdiagnosed. I mean, it is certainly possible now let me come back on full screen, right? It's important to understand this, that one child can have a couple diagnoses. So children diagnosed with autism spectrum disorder can also be comorbid, concurrently be diagnosed with PANS, right? Simply because they have that pathology, that mechanism exists. In my practice, and I've explained to you guys this, many times at your individual appointments as well, that we don't know what percentage of symptoms can be attributed to PANS or biotoxin illness or mold exposure or Lyme disease. Now, Lyme disease, biotoxin illness, mold exposure, these can all be triggers of PANS as well. Okay. Now, it is difficult to ascertain what percentage of symptoms can be, what percentage of symptoms can be attributed to basic autism and what percentage can be attributed to PANS. All right. Now, once we investigate, this is why investigation is so important. Once we investigate and we come up with a beautiful, customized, individualized plan for each child based on what the investigation finds, right? The evaluation, the labs, and based on that, PANS can be treated. Now, PANS can be put into remission. And yes, in my practice at BioNexus, what we do is in a completely natural plant-based manner. So once PANS is put into remission, many symptoms that we ascertained can be attributed to PANS versus autism. Those symptoms are alleviated, they're gone. And we'll talk about symptoms next. All right, let me go back to sharing. PANS and autism symptoms overlap. As you can see, vocal and oral tics, obsession compulsions, irritability, hyperactivity, mood disorders, anxiety, bedwetting, aggression, rage, handwriting issues, fine motor issues, emotional lability, behavioral regression to a much younger age, anorexia can even happen, extreme picky eating, difficulty concentrating, sleep disturbances, sensory abnormalities. Many of you autism parents will be able to relate to this, right? I'm one myself. I can certainly relate. All right, next slide. So, PANS, pandas. I already explained the difference to you early on. How is it, let's look at a mild case, moderate case, and a severe extreme case. Let's look at, how it's diagnosed. Obviously, lab work is involved, but symptom-wise, right, clinically, experiencing obsessions and compulsions, rituals. The child has to do something or it will result in a complete meltdown, right? Now, I have just recently, I can recall, just to give you one brief example, is the child is improving definitely on the BioNexus herbal protocol and has words, like we started using the speech blend and words were, it was beautiful. The entire speech blend and the associated blends protocol has been working really well for children. And the words started to flow. Now, since this was something new, obviously, it's going to take the child a while to figure out, how to use the new tools that the child now has, right? So the words. Now, what happened was, Mom reported that the child kept asking the same question over and over and over again, in spite of receiving answers. So Mom had to repeat the same answer or come up with another answers. Pretty much Mom had to respond in some fashion. Otherwise, there would be a huge meltdown. I mean, literally like throwing toys, hurting Mom. And it just became a really difficult situation. Upon evaluation, the child's younger brother who is neurotypical, recently came back home with strep from school. So that was the exposure, and that is what caused the tremendous flare-up, the PANS flare in this child. So we were able to address that, of course, and since it is autoimmune, it takes a while to go into remission. It can take anywhere from 4 to 6 weeks to go into remission after each exposure. So anyways, I'll touch back on that again briefly, but let's talk about this now, right? So experiencing obsessions and compulsions, experiencing eating restrictions, severe picky eating, mild to severe picky eating, experiencing motor and or vocal tics, anxiety or separation anxiety, emotional lability and or mood disorder like depression, irritability, aggression, and or severe oppositional behaviors. Behavioral regression, developmentally speaking, a 9-year-old child will behave like a 5-year-old or even younger sometimes, depending on how advanced the condition is. Sudden deterioration in school performance, right? A dramatic handwriting changes, decline in remembering how to write letters, difficulty in math. Now, this is for the high functioning child, right? Oftentimes I'll hear reports where, everything is going well, just like with the child I just described to you earlier. Speech is improving, language, focus, concentration, academic performance was improving. And then all of a sudden you see these, a dramatic decline. That in itself should give you a clue that we are looking at re-exposure. All right, motor and sensory abnormalities, somatic signs and symptoms, including sleep disturbances, enuresis, meaning bedwetting at night, and urinary frequency. Children who don't drink a lot of water. Please forgive me, I'm having a little bit of postnasal drip issues. It's pretty heavy duty allergy season going on here in the US. So, all right. Now, urinary frequency. Being able to understand urinary frequency is important. Sometimes we say, oh, my child drinks a lot of water. Sure, but that doesn't mean that the water comes out the other end right away, right? Oftentimes children with PANS will need to pee every 20 minutes, every hour, and that is a symptom. Now, if it's a mild case, symptoms are significant and cause disruptions at home and at school, they occupy a couple hours a day. In a moderate case, symptoms are distressing and interfere with daily activities. They occupy 50 to 70% of waking hours. Now, severe extreme cases, symptoms can be incapacitating, life-threatening, and occupy almost 100% of waking hours, right? Extreme picky eating, refusal to eat. I've had a couple children that needed to go on a G-tube because of a severe PANS episode. So, and unfortunately, yes, the gastroenterologists were not familiar with the condition known as PANS. All right, let's go to the next slide, see what we have. Oh, actually, that is the last slide. All right, now I'm going to stop share, come back on again. What I'm going to do now is we'll look at a couple labs real quickly to explain how this process works, to show you what we see in labs as well, when it comes to PANS. Additionally, one important thing to remember, folks, is when there is re-exposure, it is going to take a while because these are antibodies. Antibodies have a half-life. Often that can be 4 to 6 weeks. Now, when we have the child on a beautiful herbal protocol, that doesn't shorten the half-life of the antibodies. The half-life is still going to be the same. Okay. However, managing the symptoms, getting rid of the triggers, one or more triggers that caused the re-exposure and the PANS flare, that becomes a whole lot easier. Modulation of the immune system as well. So sure, we will go into remission a whole lot sooner because we have the herbal protocol at our disposal. So anytime a child is going through a PANS flare, remember, it is going to take a few weeks to calm down. And remember to keep up with the herbal protocol, right? If you feel challenged by what you're seeing, and some of the PANS behaviors can be tremendously challenging, right? For a parent who is used to autism signs and symptoms, even autism parents find it challenging to understand and go through a PANS flare. Feel free to reach out. I do have those brief appointments that we can squeeze you right in between appointments. You don't have to wait for your regularly scheduled appointment. Or another option is to listen to this podcast, right? And I have exposure podcast as well that can be helpful to you. Then I have a podcast that tackles die-off that can be helpful to you as well. Now, while I'm here, let me just touch base. If you're seeing new symptoms, that is usually re-exposure. If you are seeing a ramp up of existing symptoms, let's say when you came to BioNexus and your, just one of the symptoms that your child had was, what would be an easy one? Let's say eye blinking and as well as visual stims, right? Sideways glancing, etc. Now, when you're experiencing a die-off response, eye blinking and visual stimming is what is going to get worse. And that will happen within a couple of hours after taking the herbals, which is a great thing. That means that we are on the right track. And that usually subsides pretty quickly in a couple of days, especially when you use the mitigating protocol, right? I've given you the compensation protocol when there is die-off response. Again, I have a few podcasts on die-off that you can listen to, educate yourself and help yourselves. Now, when there is re-exposure, mild picky eating can go to extreme picky eating. There can be self-harming behaviors. There can be severe aggression that comes into play. So this is not a die-off response. These are new symptoms that you are seeing for your child. So while the symptoms may be new for your child, they still fall under the symptoms list of PANS or biotoxin illness, okay? Or Lyme disease for that matter, depending on what the exposure was. So keep your head on, be patient. By all means, visit your GPs or pediatricians. Since I'm not primary care, I'm your specialist. So be diligent, feel free to visit your local doctors, do any strep testing or any other lab testing. Blood test usually works very well, and it's available in most countries, almost all countries around the world. See what the issue is, see what is causing the PANS flare. So you will understand, and then you can speak with me and we can maybe add some herbs or just modify the protocol to be able to expedite recovery. All right, so now I'm going to go back to sharing and let's take a look at some labs. All right, so you can see here, child born in 2018. It's oftentimes mind-boggling to see the amount of inflammation that exists and it is out of the scope of this protocol, this podcast today, but I will do another podcast to explain the genetics involved. I will do another podcast to explain the in utero transfer, right? I mean, often people will scratch their heads like, oh my goodness, how is it possible that a child so young has all of these issues in the brain, right? You can see viruses, demyelination antigens, anti-myelin protein issues, all right? The myelin is what helps our nerves conduct impulses super fast. And I have a little photograph diagrammatic representation of this. I will show that to you. It's another illustration of autoimmunity. It involves that myelin sheath, but I found that online, and I'll go into that in a bit. So as you can see, all of these antibodies, brain autoimmunity, brain inflammation, anti-dopamine 1 receptor antibodies, dopamine 2 receptor antibodies, GABA receptor antibodies. So there is a lot of autoimmunity going on in this child, additional infections as well, right? Now let's look at the next one. All right, male child born in 2015. Blood-brain barrier disruption, infection, once again, demyelination antigens. Blood-brain barrier disruption, anti-microglia. Microglia are the immune cells that patrol the brain. All right. So these two children are very severe cases. The first one we saw was younger. They're severe and similar, but different age groups. Now let's look at this one. All right, this one is 2013 born, and this is actually a post. I mean, this child has been on treatment for, I would say, I think 18, 19 months. And this is the first time that, I mean, the beginning symptomatic, the beginning symptom picture, the child was very symptomatic and would say moderate. I wouldn't say severe PANS, I would say moderate PANS. But at that time, the lab was cost prohibitive and the family couldn't run this lab, but now we were able to run the lab. And we can see that we are still looking at a small amount of issues going on, some viral infections, brain inflammation. And obviously, when you have a lab like this, it is certainly an easier task to put the autoimmunity into remission. And see if I can find that myelin diagram. Before that, speaking of remission, right, understand that this is an autoimmune issue. Many of us autism parents get very focused on symptoms, right? Oh my God, I'm going out socially. It's really embarrassing. My additional family members keep giving us the look, like, it's almost like I can't control my child. My child doesn't behave in a social situation. I absolutely need to control this hyperactivity. It's getting beyond embarrassing. This is the emotions that we go through, right? What will people say? What will family say? What, is this reflecting on my parenting skills? It is very hard being an autism parent. You just feel like you're under the microscope all the time. But remember, what comes first is health. Autism doesn't come before health. Overall, general health, understanding and teasing out all of the comorbid issues, the medical issues that are happening with your child is far more important than trying to, fix the autism symptoms. A quick fix doesn't really help anyone. You can slap on as many Band-Aids as you like, with pharmaceuticals or invasive treatments. Sure, it helps in the short run, helps to buy you a few weeks of, even a few months of a little bit of relief from the symptoms and a little bit of relief from prying eyes, right? But in the long run, understand that all living organisms reproduce, bacteria, viruses, etc., parasites. And while you're busy slapping on the Band-Aid and not treating the underlying symptoms for fear of die-off with the herbals, remember that the underlying infections will grow, like all living things do. So it's important to do both. It's important to find that middle ground to help our children the best. All right, so let me, the point I was trying to make is autoimmunity doesn't have a cure, but plant-based, and there are many other methods, but what we do here is plant-based treatments. We can certainly put the person in remission. I've seen children diagnosed with PANS at a very young age, and as they grow up and grow to be adults, you will see flare-ups. A PANS flare does, a condition, an autoimmune condition like PANS doesn't go away. Crohn's, colitis, PANS, arthritis, diabetes, these are conditions that can be managed. So, oftentimes, is it better to have autism or is it better to have PANS? Well, obviously PANS, because it's very manageable. With herbals, autism is manageable as well. And remember what I said in the beginning, labs will help us ascertain what is the percentage of true autism symptoms and symptoms that can be attributed to everything that I spoke about today. So let me see. Let me go to, yep, it's right there. This is the dilemma of the antibody. All right, so this is your neuron. This is your nerve fiber that's going all the way down the body to the muscle. This is an example. Now, let me see. Thank you to Creative Med Doses. And I believe it says the credit also goes to Priyanka Singh. So thank you very much for helping educate my clients. But this was just so fantastic. So this explains the same principle that I explained to you earlier, but this, explains it in the context of myelin. Since we saw the labs, we saw the anti-myelin antibodies, right? So, another thing is it's important to understand the autoimmunity pattern of each individual. Many PANS children have a similar pattern. That is why it falls under that category. You may have seen the labs I showed earlier. The child from 2018 and 2015 had quite a few similarities, but that's where it becomes diagnostic at that point, right? Because it falls under the PANS umbrella. All right, so this is the myelin sheath. This is smooth and fast nerve conduction. The messages are going from the brain to the body in a very fast and efficient manner, thanks to the myelin. Now, as you can see, the myelin sheath has these pink circles, and as proteins in the myelin sheath. And on the right, you can see the pathogen, the bad guy, right, also has the pink antigens, right? The pink proteins on the body. Oftentimes, really smart bacteria like strep and Lyme will intentionally cover themselves, with similar looking proteins, trying to escape from the immune system. Oftentimes, they will develop and envelope themselves in biofilm, right? Mucousy biofilm to hide from the immune system, to hide from the antibodies. Now, this is the antibody, confused antibody like we saw before, and it is an auto antibody because of what it's going to do. So what does the antibody say? Both have pink antigens. Should I follow my gut feelings and kill both of them? Because remember, this needs to be done in a super fast manner. As soon as the antibody comes up and, it sees the pathogen or the bad guy, the getting rid of the pathogen business needs to be fast. That is the nature of the antibody, so that, it gives relief to the body pretty quickly. But now when there is confusion, and here we have the bad guy is happy, right? Oh, what a dumb antibody. Confused, gullible, easily duped, just like their manufacturer, meaning us, meaning our kids, right? So the bad guys are happy that the antibody, will attack the organs instead of the bad guy. But what they don't know, now looking to the next photograph on the right, the antibody unfortunately goes and attacks the myelin sheath. And the myelin sheath is like, get off me, you're destroying precious nerve conducting essentials, the myelin. And at the same time, the antibody also goes and attacks the pathogen, okay? Because there's the confusion and the antibody doesn't want to take any chances. It's friendly fire because the confused antibody thinks that it's actually helping the host. So I found this to be ironically funny, but a good illustration of the anti-myelin antibodies. There is a condition that is known as it's known as GBS, or the Guillain-Barré syndrome. And that is where this kind of autoimmunity, where the autoantibodies against the myelin sheath come into play as well. I've seen one child in my practice in the last 10 years diagnosed with GBS or, Guillain-Barré syndrome, and received IVIG one after another, steroids one after another, which is, similar to the conventional treatment that they have out there. Obviously, very helpful, but often Band-Aids. And the child recovered really well on the herbal protocol. There was a previous podcast where you would have seen that, children that are unable to walk properly, having episodes of lower extremity weakness and major incoordination issues with the lower extremity, not able to walk. Like, I had a very similar issue with my son as well, as many of you know. They do really well. This child, you must have seen in the videos, huge difficulty climbing up the stairs on all fours. And then a few months later is outside with his brother playing soccer. So that was so inspirational. I'm really happy that Mom was able to share that with us. All right, good. So I hope this explains PANS, in depth. And thank you for joining me. I will see you all once again at the next episode of the BioNexus podcast. Until then, take good care. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit BioNexusHealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.